Dr. Patel, what do sealants do to children? You know, there's this like basically, you know, getting this plastic kind of stuff over the children's teeth, is that good for adults also, or is it only for children?
Well, sealants are used for both adults and children. Mostly it is used for children, where there are deep grooves. The cleaning habits of the children are not very, very strong. They can be eating chocolates, they could be taking carbonic acid sodas and all that at any time. During that time, we recommend that all occlusal surfaces, that is the top surfaces of the back teeth, the molars especially, where there are deep grooves, to be sealed so that it doesn't get decayed from there. But in adults, sometimes we find deep grooves too, and we would like to seal them up. I do seal in adults where there are deep grooves and I see other teeth are decayed. I say, okay, nowadays the sealants are there, let's seal this up, and it may be there for a while. Or we may just use it more deep if there are grooves which is catchy. We may use those type of techniques and seal them up.
Okay, so
adults are being used also.
Okay, so what's kind of the difference between a child having a sealant and not having sealants in terms of protecting their teeth? I mean, how much more effective is it, and how much more peace of mind can a parent have with knowing their child has sealants on it?
Well, that's a great peace of mind for the parent once we tell that your child is now decay-free at least for 3 years while the sealants are there from the occlusal point of view, from the top surface of the teeth. So at least the child, if it is done nicely, it will stay there a minimum of 3 years. It may go for more 4 or 5 years, but then we would like to check it up again. And if it is done, it is a technique sensitive. There should be no moisture. There are nowadays different sealant materials. The plastics are different materials where it can take in some moisture and all that. But usually it does not require any moisture and it should be very well sealed up. Once it seals up, the parents can be rest assured that the whole thing will be there and protecting the child's teeth.
Wow, so they last for 3 to 5 years, they last basically.
Right. Of course, the parents should be made assured that that does not necessarily mean that the child is caries-free. It can get decayed from between the teeth. We are not sealing between the teeth where it can be cleaned only by the floss, whereas in children it is difficult to floss. So that's the place where you find most of the decay also.
I see.
So we have to make sure the parents understand that.
But at least the surface on top is protected, and that's of great value.
Right.
Good. Well, wonderful.
Once you eat all these chocolates, they go and stick to the grooves, and they stay on the grooves for a while, and it can get decayed. Once you drink that carbonic acid, those carbonic acid goes into the grooves, creates effervescence, and they erode the enamel from the teeth, and it gets decayed. So these are the two most common things we are trying to avoid, and other sweeteners which they use. So, of course, we did a candy buyback program recently in our office, and we have got lots of parents who appreciated the fact that we are helping the kids not eating the chocolate to get decayed. At the same time, we wanted to inform them that they should be using sealants for this.
Well, all right. Good information to have. So there's so many things out there one can do to prevent problems in dentistry. I think I've heard the saying that there is no medical branch which is as preventable and predictable in terms of treatment than dentistry. Would you second that, or not really?
Yeah, well, I will second that. I will agree to that 100%. There are so many preventive ways, right from caries to gum disease to your TMJ problem. All these, your headaches and all that, they are all preventable. They're all preventable if the right visits to the dentist every 3 months is there, every 6 months is there, as we recommend, depending on the habits of the patient. The patients are dictated by the insurance nowadays. And we tell the patients, if your insurance is paying every 6 months for a visit, but you are having periodontal disease and you need to prevent the disease from going further by visiting every 3 months and not every 6 months. But oh doc, my insurance covers every 6 months. See, they're all directed by the insurance and all those things. So we try and educate our patients on the benefits of visiting the dentist every 3 months or 6 months to prevent all these diseases.
Wonderful. Thanks, Dr. Patel.